Hello, my name is Emma Hum. I'm a speech-language pathologist with the Regional Stroke Team of Southeastern Ontario. This segment of the Tips and Tools workshop is on meal assistance and hydration. Let's start off with some food for thought. Mealtime is an important time for us. We usually spend the time for nourishment and also spend time with family and friends for social interaction. But imagine if you're a stroke survivor and you have feeding and swallowing problems. It's hard enough to hold the cup to get it to your mouth, and if you can get it to your mouth, it's hard for you to swallow the liquids. It's so frustrating, but as healthcare providers, we can help. We can provide meal assistance and hydration. Let's start with an overview of Section 8. We'll be talking about feeding and swallowing problems after a stroke, assisting a survivor with swallowing problems. We'll also look at the importance of proper mouth and dental care. Some of our stroke survivors need special diets, so we'll be looking at also risks and signs of dehydration, fluid needs, signs of malnutrition. Feeding and swallowing problems after stroke is quite common. One concern we have is dysphasia, which is a difficulty or discomfort in swallowing. With dysphasia, there are other risk factors such as dehydration, which is the lack of sufficient hydration. There's also malnutrition, which is the lack of sufficient nutrition, and aspiration. And this is when the stroke survivor is actually inhaling bacteria from saliva, food, or reflux material in the airway. And finally, there are negative effects on quality of life. There's social isolation. A lot of stroke survivors talk about being afraid to eat in public because of choking or aspiration, or needing help from others for feeding assistance. So as healthcare providers, how can we assist a survivor with swallowing problems? In general, we can ensure safe feeding practices, observe for signs and symptoms of swallowing problems, and also refer for an assessment, a swallowing assessment by a speech-language pathologist, or you can also consult your dietitian or occupational therapist. Let's look at the mealtime setup or the environment. Minimizing distractions is very important to allow the stroke survivor to concentrate on chewing and swallowing in a quiet environment. We also look at proper positioning. This is essential for the feeder, the stroke survivor, and also the positioning of the meal tray. There are also common assistive feeding devices. These devices are important to maximize independence with feeding. Consider using a plate guard, a sippy cup, large handled cups, non-slip materials, and built-up cutlery. There are common problems with swallowing and approaches. There could be problems with the mouth, there could be problems with the throat, and problems in the esophagus. The esophagus is the tube that leads the food down to the stomach. As a speech pathologist, I provide swallowing assessments. Often we do a video fluoroscopic swallowing study, which is basically an X-ray or radiographic procedure. Let's take a look at a video clip of normal swallowing function and also impaired swallowing function with aspiration. Let's start off with problems in the mouth. These are problems that you can see and observe at mealtime. The signs of problems include coughing and choking, drooling, poor lip closure. You might also see pocketing of food in the mouth. Have a look at the resident's ability to swallow pills. There may be difficulty swallowing pills, and you might see the pills sticking in the mouth. Also watch for poor intake or appetite and slow swallowing. So if you see a problem in the mouth, what could you do as a healthcare provider? Let's look at positioning. Positioning a survivor for meals is very important. So making sure that the resident is sitting upright at 60 to 90 degrees, making sure that the head is tucked forward and the head is in midline. You can also use pillows to stabilize, and it's very important not to feed from above the mouth. Here are some safe feeding strategies for problems in the mouth. Try a slower rate of feeding and small amounts of food, 1 teaspoon at a time. You may need to place food on the stronger side of the mouth if there's weakness of one side of the face. Stroke survivors should remain sitting upright for at least 30 minutes after a meal. Having a napkin or a cloth is handy in case of drooling or spillage of food from the mouth. For pills, stroke survivors should swallow no more than 1 to 2 pills at a time. Some pills need to be crushed and swallowed with applesauce or thickened fluids. One food item at a time is very important for stroke survivors so that they can concentrate and enjoy their meals. And finally, proper mouth and dental care is important. As healthcare providers, we understand the importance of proper cleaning of the mouth, teeth, and dentures. The latest research is showing a link between gum disease and heart disease, pneumonia, and stroke. But proper mouth care is very important for comfort. It improves taste and enjoyment in eating. What we need to do is help the stroke survivor remove all the plaque from the teeth, dentures, roof of the mouth, tongue, and cheeks. Ideally, this should happen at morning, bedtime, and after each meal, especially after the last meal and before bedtime. It's important to check for pocketing of the food and also to be there to assist the survivor to brush the mouth, teeth, and dentures. Here's a helpful tip. Maybe having a mouth care kit by the bedside for the stroke survivor. Here are some tools that you can have in the kit. You can have a soft bristled toothbrush. Have handy some alcohol-free mouthwash or a small amount of toothpaste. Try an electric toothbrush or a toothbrush with an enlarged handle so it's easier to hold. There should be a denture brush and cleansing solution for dentures, and also some tooth fats. You can use these swabs to remove food debris from the mouth or to help the stroke survivor moisten her mouth. Let's look at problems in the throat. These are problems that you can hear. So listen for the following. Listen for coughing and choking, a wet gurgly voice after swallowing. You may notice that the stroke survivor has had frequent chest infections, a weak cough. Talk to the stroke survivor. He or she may report a tight throat feeling or feeling like there's food sticking in the throat. If you also notice repeated swells, that's an indication of problems in the throat. So if you see problems in the throat, you can try the following. Try smaller amounts of food or fluid. Ask the stroke survivor to swallow twice to get the food down, or to clear the throat to remove the food residue from the throat. Try spoon feeding fluids and also avoiding straws to ensure that the person is not taking large sips of fluid. Talk to the stroke survivor about some of these problems. Some stroke survivors complain about a lump in the throat or food sticking in the throat, that it's difficult to swallow solid foods. There may be a feeling of heartburn or reflux after a meal, or fullness after eating a very small amount of food. Other signs of problems include coughing up food particles during or after a meal and a chronic dry cough. So if you see a problem in the esophagus, try the following. Small and frequent meals are helpful. Sitting up for 2 hours after eating helps with digestion, and also elevating the head of the bed and wearing loose-fitting clothes. Some of our stroke survivors need special diets. There are puree foods, which are creamy, blenderized foods, moist minced foods, which are foods that are chopped up, easier to chew and swallow. Some stroke survivors do not eat dry particulates. These are foods that are dry and crumbly, such as cookies and crackers and chips and nuts. Other stroke survivors cannot eat bread products because of its gummy and sticky consistency. It's important to not mix consistencies, to always separate solids from liquids during meals to make it easier to swallow. With fluids, some stroke survivors cannot swallow thin fluids safely and need thickened fluids for hydration. There are also foods to avoid which may cause acid reflux. Let's look at the risk factors for dehydration. A stroke survivor may be at risk for becoming dehydrated if he has difficulty swallowing thin fluids, or he may be refusing fluids at mealtime and snack time. He may need help with eating and drinking, or even feels the lack of thirst, doesn't feel thirsty at all during the day. For certain individuals with communication problems or memory problems, they may not be able to express that they're thirsty. And if there's an illness or vomiting, you should also watch for risk of dehydration. And finally, some individuals have a fear of incontinence and may not be drinking enough fluid during the day. Here are some signs of dehydration. Watch out for decreased urine output, dark, concentrated, or strong-smelling urine, frequent urinary tract infections. Look in the mouth, see if you notice any thick, stringy saliva. Other signs of dehydration include constipation, dizziness, confusion, rapid weight loss, fever, and finally watch for decreased skin elasticity. You can use the pinch test by holding the stroke survivor's arm and gently pinching the skin. If the skin fails to spring back and it looks pinched up, that's a sign of dehydration. So let's look at fluid needs for health. On average, a stroke survivor needs 8 cups of non-caffeinated fluids on a daily basis. Some stroke survivors have problems swallowing thin fluids. Be careful of the following list of thin fluids that individuals may need to avoid. Water, all juices and soft drinks, milk, tea and coffee, broth and cream soups, some of the commercial supplements including Onshore and Boost. A thin fluid also can be ice cream, sherbet, milkshakes, gelatin, ice cubes, and ice chips. Talk to the speech-language pathologist to see if the stroke survivor is able to swallow these thin fluids safely. Let's talk about malnutrition. Here are some signs and symptoms of malnutrition. It includes weight loss, reduced vitality, skin breakdown, impaired wound healing, and reduced resistance to infection.
For additional information on the topics covered in this video, contact your local stroke strategy. Key resources available include Tips and Tools for Everyday Living, a guide for stroke caregivers, Section 8, Meal Assistance and Hydration, the booklet, Improving Recognition and Management of Dysphasia in Acute Stroke, and finally, there are feeding exercises available for you to try. Links to these resources and this video can be found on the Stroke Strategy of Southeastern Ontario website.